the cloud. All right. Well, thank you everyone for joining us. My name is Lauren Johnson. I am the Community Engagement Facilitator over at the Prevention Council of Putnam. I'm working on the Healing Community Study Grant, which is working to reduce opioid overdose by 40% here in Putnam County and within 8 other counties throughout New York State. So I'm very happy to have Victoria Metz here to talk to us today a little bit about the work she's doing in collaboration with the grant. So Victoria, why don't you go ahead and introduce yourself and we'll get this going.
Sure. Thank you so much, Lauren, for having me. I appreciate it. My name is Victoria Metz, and I am a recovery coach here at Arms Acres in Carmel, New York. And I am working in collaboration with Lauren and the healing community. And we are working in conjunction with, well, I am as well as another peer here. And we're working in collaboration with you. But I just wanted to say that recovery coaches, what we do is we actually work with the patients here and also out in the community in actually engaging them in resources. Basically, that's what a recovery coach does, is actually we bring well, I don't like to call people patients, what we call them actually we're trained to call them recoveries because they are recovering. And we actually basically help them get resources in their community, whether it be a doctor, a dentist, a resource center, maybe here in Putnam, we have Cove Care. We have Arms Acres outpatient. Basically, they're suffering from SUD or AUD. Right now, it's opioids. We're focused on OUD, opioid use disorder. So we actually want to hook them up with maybe Vivitrol, Vivitrol, Suboxone, something like that. So we would probably, bridge the gap, meaning send them maybe to Arms Acres outpatient and have them maybe try whatever they want. So basically, a recovery coach would walk alongside someone to pave the way, their path to recovery. So that's basically
awesome.
And help stop the stigma. That's basically, there's a lot of stigma behind that as well, whether you have AUD or SUD.
Absolutely.
And mental health. So I'm actually a peer specialist. So the difference between a recovery coach and a peer specialist is a recovery coach actually deals with recovery from substance use disorder and AUD, alcohol use disorder, and a peer specialist is mental health.
I see.
And I'm actually both. So
that's amazing. I mean, I know in working with you, the amazing work that you're doing both in the community and over at Arms Acres. And I know for those people who are not familiar with the difference between a peer recovery advocate and a counselor, can you kind of talk about what the different roles are between somebody who is a counselor at Arms and the work that you do as a peer? How does that differ?
Oh, it differs greatly. One thing that we learned along the way getting our recovery coach, well, it's not a recovery coach certificate. You go and you get your recovery coach and your ethics. So that's like a 46-hour course.
Yeah.
But then you get your CERPA, which is called a Certified Recovery Peer Advocate, and you're certified by the state. And that's what Marianne and I have. So we're certified by the state, and we always have to, we call it stay in your lane. Mm-hmm. And that means we are not clinicians. So you have to have your CASAC to be a clinician or your CASAC-T, and that's through OASIS. And I am going towards that. However, when you're a CASAC, you actually sit with your client, you're doing a lot of paperwork, you have to you have certain ethics, certain guidelines, you're setting up inpatient, outpatient. When they leave, you have to have a discharge plan. You're planning what they're doing also in Arms Acres. As far as myself and the other peer, what we're doing is we're doing in-house engagement, but we're also maybe giving them information about outside resources. There's a difference. Maybe resources in their community. Do we have a resource center? Or maybe in Brooklyn, they have a resource center. I focus on where they have recovery coaches because that's my job here. I know that they can utilize them out in the community. And a lot of times patients here do not know about recovery coaches. So I will do a group here about recovery coaches and where you can find them out in the community, because they will be an asset to them when they're out in the world or in their community.
Yep. Yeah. And I mean, the great thing about you being as a peer being certified now as certified recovery peer advocate is that it allows individuals to be reimbursable within the treatment center. So we're able to use Medicaid, Medicare, we're able to use insurance to fund those services for recoveries. So people in recovery are able to access your services even more readily now. And what I love about the work that you're doing as a peer is you're going out into the community. I know that COVID has made that a little bit more difficult in recent years, but you're meeting people out in the community. A lot of the work that you've been doing with our local police departments and reaching out to high-risk individuals, you're meeting with them, you're on the phone with them, you're reaching out, you're going out into the community. And so you're sitting with them and able to kind of meet with them on a different level. There's no judgment, there's no shame. You're just trying to talk to them about the resources that exist. So I wonder if you want to talk a little bit about like what different things do you offer individuals at that point where they're not quite sure if they want to go into treatment, they are not quite sure if they want medication for opioid use disorder or a referral like that. What other kind of things can you offer as a peer for somebody who's in that at that stage?
Well, the thing is with peer advocates, we have lived experience for one, so we kind of get it. We might not have the same issues, but we have the same feelings. So let's say I'm working with, let's say, Kent Police Department, take them for instance, which they're wonderful.
Mm-hmm.
And so let's say I go there, I get some names, or I have some people that I need to call. So I call them up and we just chat, or they call me back and we chat. They're like, what is this in reference to? Blah, blah, blah. We start chatting.
Mm-hmm.
And they want to meet me, just because I'm a peer. So we meet and we start talking, and it's just a conversation like we're having.
Mm-hmm.
And then I say, what can I do for you? Because as a peer, we're actually working for that person. We're asking them, what do you need from us? What do you need from me? Because I'm here to help you. Initially, that's my job. I never feel like I'm working
Mm-hmm.
because I'm walking alongside of someone. I want to help you. This is what I do. And, when I first meet someone, I'll give them a POM card. So this is the POM card that you furnished me with, NIH Healing Initiative, this is what I give them,
Right.
so they can read that. And then I can say, and then also you had given me one of these as well. And these are referrals. So they have referrals on the back. So this is, firsthand what I can give them. So they have something in their hand. People love handouts. I love handouts because you can refer back to them. So you don't have to remember all the information, because I talk really fast. So you don't have to remember everything, which is great. So you have that. I give them my number. So they have that. They can text me, because people love to text. If you're under 40 or under 45, you just text. You don't feel like talking. So anywho, we just have a conversation and I just ask them what their needs are. So if they are out in the world and they may use, and I'm like, I'm not the using police. Mm-hmm. So if you have a need and you want to call me, if something happens, just call me. And I have people that do that they use, and they call me and they're like, oh my God, I used this weekend, and I say, okay, what would you like to do? They may say, I need outpatient, which I had the other day. Mm-hmm. Okay, well, where would you like to go? Can you make me an appointment, or can you help me with this, and that? Absolutely. So recovery coaches are there to, like I say, I can't say it enough, is that recovery is self-determined. Mm-hmm. So we walk alongside. We don't walk in front. We don't walk behind. We are peers. So we walk with you. And that's the difference between a counselor or a doctor or anything, or a therapist. We're here to guide, to be with you. Sometimes people may think we're a guide or a mentor, but we're still with you. So we're there to help. So when someone cries for help, hopefully they call us and we get on the phone for them or with them. I mean, we're trying to teach them how to get back on their feet, right? But we still will help them do the legwork.
Yeah, absolutely. I mean, that's very beautifully said, first of all. And I love that you're able to kind of meet them where they're at. So their journey may be defined differently than yours, like you said, but you're helping them get back on that journey, their journey, walking beside them. So yeah, I absolutely love that. And if they're not ready, you give them resources, like you showed the handouts. And if they're not ready to make that treatment, what I love is that you can give them naloxone or other harm reduction type things that help support them. You're not judging, like you said, you're not shaming. You're just giving them tools to help them where they're at in their journey. And at that point, if they're still using, they're not ready to enter treatment or do whatever it is that they need to get back on their recovery journey, you're equipped with things like naloxone to help ensure that if they get into a bad situation, that they have that there to help reverse any opioid overdose, if that's appropriate for them. You have the fentanyl test strips now that helps them kind of protect themselves if they, again, are still using and they want to test whatever they're using for fentanyl to make sure that they're not putting themselves at any more risk with that. So you're really just such a gem in the community, making sure that we're keeping, I mean, you really are. I mean, peers themselves are an amazing resource that we really love you, Victoria, and we love the work that you're doing. And
thank you. I love you guys.
No, well, listen, it's mutual. But so if anybody is interested in peer recovery services, whether it's through ARMS, how do they reach out to kind of get those services?
Well, probably through you.
Okay, yeah, that's one way. Yeah.
Yeah.
They can definitely give us a call. Yeah.
Yeah, because I'm in-house, and I do a resource meeting here and I give my cards out. And the funny thing is, I gave my card out to someone and someone called me the other day, but they called me through someone else, so people have my cards, but the only way that they could probably get to me is probably through the Prevention Council.
Yep. Well, the great news, we do have several other peers throughout Putnam County. We know that some people prefer same gender, or so, we do have male and female peer mentors, or peer advocates throughout the county. We have people who are located on the west side of the county. So there's a lot of different peers that kind of meet some different needs for whatever the individual is looking for. So yeah, if you call the Prevention Council, we can definitely get you connected with one of those peers. If you don't know what you're looking for, we can hand you over to whoever is available, or if you're looking for something specific, then we can help connect you. But we have peers that are at Arms Acres. There's a peer over at Cove Care and St. Christopher's. So you have a lot of different options. If you're considering recovery, you're not quite ready yet, you just kind of want to learn more about the resources like Victoria talked about, I think it's an excellent step to just kind of call and have that conversation like Victoria explained. So thank you so much again, Victoria, for doing this. And we really, again, appreciate all the work that you're doing. And we look forward to continuing the collaboration with you.
Thank you so much. I do as well. Thank you.
Thank you.